Bismillahirrahmanirrahim. Today we will discuss an important communication case which can appear in both MRCP PACES as well as Irish exam. Dr. Yusuf will perform. According to MRCP Irish, you will get 6 minutes total. I will warn you when 1 minute is left. So the case is about a patient who has rupture of esophagus. Dr. Yusuf, be ready. Your time starts now.
Hello.
Yes, doctor.
Hello.
Yes.
I'm Dr. Yusuf, one of the doctors working in the gastroenterology clinic today. May I confirm that
gut clinic? Gastro is a jargon.
Yeah, gastroenterology gut clinic. May I confirm that you are the son of Mr. Henny, 64 years old?
Yes, doctor.
Okay. Are you the next of kin to your father?
Yes, doctor.
Okay. Before beginning discussion about this medical health of your father, I would like to ask you only one question. That is, if you have any idea about what's going on to your father?
Yes, doctor, my father, he is a lifelong smoker and he had so many problems in the past also. We came with this narrowing of the food pipe, and now also he had the same issue, narrowing and swallowing problem. So you have done some test and you did some dilatation, I believe. So how is my father now?
Yeah, this is exactly what happened to your father. And actually, because your father has problems with swallowing and drinking because of the narrowing of the food pipe, and he agreed to do a dilatation to the food pipes.
You mean widening, right? Widening, okay.
Yes, widening, yes. Widening of these food pipes. And actually, the operation was done. And actually, I have to tell you that your father has developed some complication after this dilatation.
Oh no, doctor, what do you mean? Please tell me.
Yes, actually, this is what exactly happened. As any procedure has complications, your father has developed a perforation of the food pipe during the operation.
What do you mean, doctor? You mean a hole, a tear?
Yes, I'm sorry to tell you that.
Yeah. Oh my God, doctor, what have you done?
Yeah.
Why it happened? Because of your mistake.
I actually appreciate your concern, and this is happened unintentionally, and it is a complication of the procedure. And the treating team.
Doctor, before also my father had done this procedure. Why it happened now? It is your mistake.
Yeah, sorry for that, and I actually appreciate your concern. And as any procedure, it has complications, and these complications was your father agreed to do this procedure before it, and I think he knows about the side effect of the procedure, which is very minimal, but it can occur in any sort of operation, and this is what happened to your father. And again, I'm so sorry about what happened to your father.
Doctor, but I want to complain against your team.
Yes, this is your right to do complaint, okay? But I think your father has the right to do the complaint, okay? Because he knows.
Okay, doctor, what will you do now?
Okay, what we are going to do now, we consult we have a connection with the surgical team to see your father, and we try to put him in a monitor of his vital signs, blood pressure, and pulse rate, and everything. And the idea of the surgeon, of the gut surgeon, said that your father is for reoperation.
No, doctor, no, I don't allow you to do this. You have done before also this mistake. Again, you will do some problem. So, and doctor, please don't tell my father about this tear. He will be very upset.
I actually appreciate your concern, and I know this news is very hard for you, but the operation
will hard it is for you to take this and to, if you but what we can do.
Dr. Yusuf, continue.
Okay, and this reoperation for the correction of the hole to his food pipes is done by the medical team, and this decision is in the best interest of your father. So that, and also your father has the right to know exactly what is going on.
Doctor, but again you will do some blunder, some mistake. I don't trust you.
I appreciate your concern actually, but as I told you that your father's health now need to be operated because it is very dangerous not to do correction for this perforation. And this decision is taken by a multidisciplinary team, including the gut doctor and also the
Doctor,
surgical
what danger? Team. What danger it will be? Can't you avoid the operation?
We cannot avoid operations. This is the best option for him. That it will cause infection for him, it will cause bleeding inside. He may lose some blood inside. Maybe he will go to very serious and unpredictable complications if this hole is not corrected well.
Dr. Yusuf, you can draw and explain. It will be good impression.
Yes, yeah. So that I will draw for you. If you see here, this is the food pipe.
20 seconds are left. Sorry, I didn't. Okay, 20 seconds. Okay, you will quickly draw. Okay. So, doctor, but doctor, still, I don't allow you. And please don't tell my father about it.
Okay. So actually, I'm sorry again for this one. And I told you that your father, you don't have the right to refuse this operation.
Okay.
Because
time up. Yes, Dr. Yusuf, I gave you 6 minutes. Although in my sessions, I always give 1 minute less. So I should give you 5 minutes. But this was a long case. There were 2 things in this case. So I gave you 6 minutes and you covered them well. Okay, but you can improve. Okay, you know the legal issues, but you are not so fluent and not so fast to cover it. So when patient was arguing and angry, so don't waste time and explain by drawing. It will be good impression. And then in the end, one concern was, don't tell my father. Did you answer that correctly?
Yeah, I told her that your father has the right. If she has any wishes, your father have any wishes to or advance directive or
no. So if you don't have time so much, so you have only few seconds, and he told you, doctor, don't tell my father. So you will say, I'm sorry, but your father has capacity. He has the right to know everything. He is holding legally the right to know everything and to decide about the resurgery. This was your last point which you missed. Otherwise, overall, it was not bad. It was good performance. But little bit of more fluent you can become. Okay.
Yes.
So this case was a long case. There were 2 things. One is the breaking of bad news of perforation, which you covered very well. Just add the drawing part. Drawing will give a good impression to the examiner. Only draw the esophagus, the food pipe, and draw a small hole and say the food particle will come out and they will cause infection in the lungs. That's why it is required to do surgery. This will be very clear then, drawing. Got it?
Okay, yes. Yeah,
whenever possible, in all cases, MRCP, Irish or PACES, draw in the communication. It will be good. Only few seconds for drawing. Then the concerns, the patient told you 2-3 concerns. First was, you covered first concern well, that patient told, this was your mistake, doctor. You did this. So you said that no, it is not our intentional. It was not done intentionally, and mistakes do happen even in expert hands. Like you can add this line, mistakes do happen even in expert hands. Always there are some risk and benefit, and I'm really sorry it happened in your father's case. So try to explain that this is not our mistake. This is not error. Okay, is it clear now? All of you.
Yeah,
because last session I took error case. And in error case, we have to, no, it is not a mistake. It is a complication. It is a side effect, yes. So last time we did error case. In this case, I want to tell you that whenever such case of complication comes in exam, no need to make incident report. No need to make any apologize. Yes, you will apologize. You will say sorry, but not many times. Only 1 or 2 times. I'm sorry it happened in your case, but it was expected. Mistakes do happen. Your father gave consent The word consent should be used. Dr. Yusuf, you didn't use this word at all.
Yeah,
I didn't hear. Yeah.
I told the meaning of consent so that he was informed about the procedure.
You told the consent that your father was told everything, but again we have to do surgery. So there are two parts in this case. There are two parts. Again we have to do surgery, and we need permission from your father because he has the right to know everything. He is mentally capable to decide. This was your last concern, which was missing. Maybe because of time issue, maybe you didn't know how to express fluently, but this is required. Now, if you suppose you missed this concern, okay, in exam, they will ask you in Viva. The patient was not agreeing, the son was not agreeing for resurgery. What will you say? Tell me, doctor.
Okay, if the son has no right to refuse for this one, because if it depends, if the father has capacity or don't have capacity. If the father has capacity, in this case, the son has no right to refuse. And if the father don't have a capacity, I will ask about advance directive and
very good.
Yeah.
Lasting power. Very good. If the father lost capacity, then only we will ask about advance directive and lasting power. So it will be very long case then. So this is not written that the father lost capacity. So we will assume, we will assume that the father has capacity until it is mentioned in the case. Until any case it is mentioned, we will always assume that the patient has capacity. And if the patient has capacity, no need to ask about the advance directive or lasting power because of the time issue. In the Irish exam, you have 6 minutes. In the PACES exam, you have more time. I am talking about old format. But in the new format, yes, in the new format also you have 10 minutes in the PACES. So you can easily handle this case in PACES. But in Irish, it is a tough case. You have to deal very quickly and very cleverly the legal issues. And Dr. Yusuf tried his best. So it was good performance. Okay, only mention the concern properly, answer them. So in the Viva, I'm asking now, yes, you are right. Patient has capacity, so we need the consent of the patient. Son does not have right to decide about the surgery. Okay, did you succeed in convincing the son?
Convincing the son about
surgery?
Refusal of surgery. Yeah, I just tried to explain to him the seriousness of the perforation if not fixed.
Yes, your concept is good. Dr. Yusuf, your concept is good. You need only practice. So this is important, okay? Let me explain to others that whenever there is lack of capacity, it is written in the case. Then you have to ask about advance directive and lasting power. How will you ask in the non-jargon way, Dr. Yusuf?
The advance directive?
Yes.
Yeah, I will ask that if your father has any wishes. This is question number one about his health. Number two,
wishes. Okay, written wishes.
Yeah.
Okay,
yes.
good. Wishes. What else?
Number two, if your father appointed or signed anybody to take a decision instead of him, in case of he cannot do a decision because of medical health or any other condition. Okay?
Very good, very good. So I will again repeat. Has your father expressed any written wishes? This is advanced directive in non-jargon way. The second is lasting power of attorney. How will you say? Has your father expressed anyone to decide about his medical problem if his condition worsens? I repeat, has your father expressed anyone to decide about his medical problem if his condition worsens? This is lasting power. Yes. Explain. Medical error and negligence both are same in PACES exam. Don't confuse yourself. In the past, it was difference. Negligence means that it is not a very big mistake. It happened, but error is the mistake. So nowadays, both are interchangeable. Don't confuse, Dr. Kamran. They are same, medical error or negligence. So negligence is no longer used now. In exam, only error and complication. You have to differentiate. And it is very easy to differentiate. In error, it is the mistake of the team, medical team. In complication, it was expected, known risk which happened, and it is not our mistake. So in complication, we will not make incident report, but we will apologize, and patient has right to complain, and we will guide pause. Dr. Yusuf, did you mention pause?
Yes. Mention, sorry?
Pause. Patient advisory lesion service.
No.
You don't know this?
Yeah, I know this one. I didn't mention it. I told him this is your, but
I told you, doctor, I told you, I want to complain. So
yeah, I stuck in one point, but have a better. I know that I confused in this one. If the patient himself
you will say like this, doctor, I want to complain. What will you say?
Yeah, I said that yes, this is your right. Completely, this is your right to do complaint, and I will try to help you in this manner because I will send
so tell
you to
this instead of telling long line, you can tell yes, you have right, and we will guide you to patient advisory lesion service. I will write also. Yeah. So you are telling right. You are telling right, but mention this, Paul, so that because this is a legal issue.
Okay, but my question here, sorry, if the son has the right to complain or the father himself has the right to complain?
This is the point I want to tell you. In complication also, patient has right to complain. In error also, in complication, both cases, there is a problem. The father has problem. Whether this is error, whether this is complication, the son has right to complain. The father also has right to complain. So whenever there is complication, they have right to complain. So only say like this, yes, you have right to complain, and we will guide you to patient advisory lesion service. Enough.
Okay. Yes.
Okay. Then don't say that, yes, it is your right and we will help you and we will guide you. Just say pause. Time will save because your time is very short. Okay. Then what else? Legal issue. Okay. Duty of candor is ethical issue in case of complication. I repeat, duty of candor, which is admitting honestly that it happened, okay, that something harm has happened to the patient. It is not our mistake, but it has happened. So we will tell the patient honestly that when we were doing the widening of foot pipe, I'm sorry that a tear happened in your father's case. Slowly, politely break the news, bad news. This we are admitting that there happened an error, a mistake. It was not actually mistake, it was complication. So we will admit that this happened in your father's case, and I'm sorry. So in this case, duty of candor, we are admitting honestly, but this is not a legal issue. This is ethical issue. Ethically, we are bound to tell the son about the rupture. Like Dr. Yusuf has said in the beginning, he admitted that this tear had happened. So this is admitting honestly. This is called duty of candor. And duty of candor is ethical issue. Ethical means it is our moral duty to tell. So it is ethical in case of complication. But in error, it is a legal issue. We have to tell this. Legal means we are bound to tell this. Why we accept duty? It's not our mistake. Yes, this is not our mistake, but we are admitting that this happened in your father's case. We are explaining that the tear happened. We will draw the picture. This is all duty of candor. It is ethical issue. Now tell me ethical issues, Dr. Yusuf.
Okay, the ethical issues, number one is the autonomy. The patient has the right to know everything about his medical condition, also has the right to share in the management of his condition.
Good. Then
number two is the efficiency. Do the best to the patient in case of this patient has perforation. We should try to fix
this the beneficence.
Yeah. Beneficence. Beneficence is do good for the patient, like trying to fix the problem of perforations here. And contact the medical.
First tell the beneficence, so doing good. So what good you have done? We are trying to open the foot pipe. We are doing this dilatation. We are doing the test. Okay, the lab test. We are doing the dilatation. This is good, doing good. Dilatation is doing good. Then non-malfeasance. What is that?
Not doing bad for a patient. I mean
Very
that,
good.
Not allow the perforation without fixing it.
Very good. We will prevent any infection, any bleeding, any side effects of perforation. This is all non-malfeasance. And justice?
Justice is treating the patient irrespective of the age or the sex of the race or like this.
Very good. So your concept is clear. Very good. Your exam is near, and that's why I gave you this tough case. Okay, you did handle very well. Listen to the audio again. It will make your concept more clear. Any case of complication, if comes in exam, you can handle it easily. Your task is to differentiate between error and complication. Read the case 2 or 3 times, whole case. There will be long case. Read it 2-3 times and decide what is it about. Is it error? Is it complication? It is explaining any procedure? Is it bad news? What is that? So if it is complication, then no need to make incident report. And the duty of candor, yes, we have to admit it. There are many questions in the chat box. I will try to answer them one by one. Okay, because station 4, this communication, it is all concept making. If your concepts about legal issues are clear, you can handle any case easily. Dr. Yusuf, thank you so much for performing. Any questions? Yeah, any questions, Dr. Yusuf?
No, thank you. I'll just complete with you listening to the other cases. Thank you.
Very good. If the patient lost capacity and the son has LPA, very good question. If the patient has lost capacity and the son has LPA, and we ask that, do you hold the father appointed you? Yes. Even then, the decision will be, when we consider the risk and benefit, this surgery will give more benefit. Okay, and if we don't do surgery, it will be harmful. That's why the final decision will be with the medical team. The risk and benefit we will weigh, and whatever is in the best interest, we will decide. So whenever there is conflict, I'm answering about a question. So whenever there is conflict between the son, who is holding the lasting power, and the medical team, both are having decision conflict, then the case will go in court of protection. What is court of protection? It is independent legal authority which will decide what is in the best interest of the patient. We will tell everything, and obviously they will decide with the medical team. Whatever medical team is thinking, that is in the best interest of the patient. The son is LPA, but the son does not know the critical condition of his father, that if we don't do surgery, he can also die. Try to warn him. Try to explain him the drawbacks of not doing surgery. In PACES, you will get time to try to explain that if we don't do surgery, the food will enter into the lungs. It can cause infection. It can cause sepsis. Your father condition will worsen. It will be life-threatening. That's why we need to do the surgery again. Like that, you will convince the son. I hope I answered. Difference between truth telling and duty of candor, both are same. They are interchangeable, okay? Duty of candor means it is our right, it is our duty to tell everything. Both are same. Yeah, duty of candor and false. Yes. Any question, doctors? I repeat, the legal issues in this case. First of all, the 3 C's. You will go systematically in exam. The 3 C's are capacity, confidentiality, consent. The 3 C's, I'm telling for those who don't know. Capacity, in this case, yes, the father has capacity to know. He has capacity. And confidentiality, yes, it is applying. We are breaking confidentiality. We are talking with the son. So confidentiality also applying. Then consent, yes, the third C is consent. We need consent of the father to do surgery again. So consent, confidentiality, capacity, all 3's are applying in this case. They are 3 C's, they are legal issues. Then go to the main theme of the case. What is this case? This is complication. So in complication, we will only mention pause. We will not mention incident report because this is not error. So we will only say pause. What else are the legal issue? Lasting power and advance directive. If it applies in your case, suppose the father had lost capacity and you ask about lasting power and advance directive, then only mention legal issues. Otherwise, no need to mention. The examiner will ask you that what is the lasting power, then you mention. Otherwise, no need to put yourself in danger. These are legal issues, but they are not applying in this case because the father has capacity. He has not lost capacity. So when there is capacity here, the advance directive and the LPA, they have no value to us. Okay. So if the father has capacity loss, then only you will mention. Otherwise, no need to put yourself in danger. Maybe the examiner will ask you. And then the duty of candor will be ethical. So you will not mention in legal issues. Then the ethical issues, again, I am telling autonomy, beneficence, non-malfeasance, justice, and duty of candor, which is ethical. We have to tell the son honestly that this tear has happened in your father's case. It is not our mistake. It is a complication, but I'm sorry. I apologize. This is called duty of candor. I hope it's clear now. Okay, doctors? I will share recording. These are very clear. If you understand properly, you can handle any case in exam. If anyone wants to discuss difficult station 4 case, you can share with me. I will discuss in the next free session. Okay. I will try to discuss next week. Whatever difficult case you want to discuss, you can share with me in the WhatsApp privately. Okay, doctors. So any questions?
Doctor, if patient is unconscious and the son has LPA,
Yes,
and he still refused.
Yes.
Yes, he still refused the surgery after we explain about the benefit and the risk.
Then we will
So
say,
I told him,
yes, then we will say that we will
my
arrange
consultant to explain again.
Yes. We will not go in argument with the son if the son has LPA and the patient has lost capacity. We will say, we will discuss this with another meeting with the consultant. Like this.
Okay.
Don't make yourself in danger. Don't argue with the son. Because I told you the case will go, again we will discuss with the court of protection and they will decide whatever is best interest. So don't say everything to the son. Only say, we will discuss this with our consultant in another meeting. Like that. They might explain you more,
I will not say
more detail.
about that's a legal issue. I will ask about legal advice.
Yes. If you're appearing in PACES or Irish?
PACES.
Then PACES you will have time. It will be 10 minutes total with the patient. You will discuss the lasting power and advance directive.
Yes, I will discuss them. But if patient still refuse, can I explain to the son? Can I explain to the son that this is legal issue and we will ask about legal advice, or no need to comment that?
If the son asks you, the doctor, I don't want to do surgery again, and the father has lost capacity, right? You are telling that father has lost capacity. Then you will discuss this. Then you will discuss this advanced directive and lasting power. If the father has lost capacity. But if the father has not lost capacity, then no need to discuss it. Why you put yourself in danger? Okay.
No, if the father loss of capacity.
Yeah, then you will discuss. Then you have to discuss.
I will discuss.
Yes.
I said about the sentence. Shall I tell the patient we will ask about legal advice? This is sentence. Is it right to tell to the son?
Yes, you will tell this. That your father, if you have legal issue, suppose father has lost capacity and the son is arguing, then you will ask, may I ask you some important issues? Has your father expressed any written wishes? No, doctor. Has he appointed anyone to take decision on his behalf? Yes, I'm holding the authority. Okay, we respect it. We respect your lasting power, but Actually, the medical team has decided that doing surgery is in the best interest of your father. Otherwise, he will be in danger. No, doctor, I don't want to do surgery again. Okay, relax. We will arrange another meeting with our consultant who will explain you better. Like this, handle the case smoothly, politely. You got it?
Yes, doctor. Thank you.
Very good. These are confusing, I know, but there is always a way out to handle a case. Whatever case, you have to handle it confidently, smoothly, politely, without arguing. It is applicable in this case, it is ethical issue. I told you again. So please listen to the recording. It is very important case and make your concepts clear for communication. Okay. Any difficult case, anyone can share with me in WhatsApp and I will try to do in the free session next time. Okay, doctors. Thank you so much. Thank you, all of you. Stay blessed.
Hello.
Yes, we will arrange appointment with consultant.
Yet
Yes.
this duty of candor is applicable here, doctor.
Yes, I told you, duty of candor means admitting honestly whatever has been done, admitting. So in this case, it will be ethical issue. Ethical means if you tell the son, it is good. Okay, but legal means you have to tell it. It will be legal issue in case of error. If something error has been done, your mistake, your medical team error, then you have to tell. This is duty of candor. It will be legal issue in case of error.
Okay, thank you very much.
Yeah, but this is not error. This is complication. So it will be ethical. Okay, doctors. Thank you so much. Thank you, doctors.